Hi everyone, I'm Dr. Sona Abraham. I'm an endocrinologist based out of Kochi. I'm here to discuss with you a few of the questions which are on everyone's mind because COVID is what's kind of the most important thing that's going on right now. And I think a burning question which many people have right now is what is the connection between COVID and diabetes or diabetics for that matter. And I think the bigger concern really is that how does COVID affect diabetes? So I think COVID would not directly affect diabetes. That would be an incorrect statement. But yes, like any infection in a diabetic who is poorly controlled would turn to be much more graver. The same applies with COVID and diabetes. So I think it goes without saying that we need to do a better job of managing our diabetes because that would be the best way to, avoid any further deterioration because of an added risk for COVID. Because diabetes, a poorly controlled diabetes, is also damaging to the immune system. So that is also something that we need to kind of consider. Coming to the question of the telemedicine app BeatO, and I would say I have been lucky, you could say, to have been part of the original, to be working with the team when they were ideating on creating BeatO in the first place. And I have actually had patients who have used BeatO, and even for the last 1.5 months, we have been actually working on the telemedicine part of the app, which is the cloud clinic. And so I have been consulting a lot of patients who actually have been using the app and giving me, and I've been actually actively asking them how the app has worked for them. Just today I saw a patient who told me that that they had had a sugar of like say 200 or something about a year ago, and they had gone to a major hospital and they were somehow prescribed insulin, and that worried them quite a bit. And this was a young man, he was a 37-year-old, recently diagnosed diabetes with sugars that weren't that high, and so he was a fitness trainer too. So he decided he was not going to take the insulin, and he decided to download the BeatO app that day. And within a period of 2 months, he managed to bring down his HbA1c by a 1%, which is what any medicine in diabetes usually brings down. Adding any new medicine to diabetes regimens usually brings down the HbA1c anywhere to the tune of 0.5 to 1%. Maybe depending on how high they were in the first place, maybe 1.5%. So this as an intervention shows to have great promise. Now, the bigger thing which a lot of people, harp about, a lot of patients ask about, is the accuracy of the device. See, I think the big thing people need to understand, yes, using a finger stick venous glucose is going to be a much more accurate way to get the right blood sugar, but at the same time, it's not practical. So we would need a mechanism where we can do multiple checks of sugar, and really what we are focused on and what actually helps manage diabetes better is to watch the trends, to see patterns, and that is what is the most informative part. Now, the beauty of the BeatO app is that it has that built into the system, because it has that part of the algorithm, the machine algorithm is built into it. So it is an added benefit arm to the doctor in terms of crunching the data that the patient has put in and giving you a much more meaningful decision-making guideline. Okay, so if your if your numbers had been such and such numbers for a consecutive period of time, then it would trigger an action. It could be a diabetes educator consultation or a phone-in, or it could spit out a few recommendations that the patient can do on their end, or it might say that no, look, this is not working. It might need you to actually consult a doctor and prompt the patient to take the right action. And as long as the patient is actively engaged with the app, I think that is the beauty of algorithm based apps like BeatO. But at the same time, it needs a motivated patient. Now, if you don't check your sugars, no data, no output. So I think the key thing is being able to put in sugars. The more sugars you can actually upload to the to any program, or to even to your own knowledge. Ignorance is bliss. I could not check my sugar, and it could be 400, 500, and say I'm feeling fine. That's not great either. So the fact that you have data and you have a machine tell you, a computer algorithm process that data for you and tell you do this, do that, it's, I think, a bridge between a doctor. And I think for a large number of patients that's revolutionary, because who can go see a doctor every day, or you can't, somebody asks. So this is like a friend on the side who's telling you do this, do that. And in case of serious trouble, when it has like a green, yellow, red levels of escalation, I would say, in the decision making tree. And if it is a yellow, it would trigger off maybe a diabetes educator consult, and if it is a red, it would flag off a doctor consult. So I think it is effectively a tool for the patient to better take care of their diabetes, but nothing beats a motivated patient. So that's my 2 cents about this whole thing. But as long as COVID is in place, I think all the more reason that we should all be taking care of our sugars much better, so that we can keep that immunity up, so that we are less prone for any infection, not just COVID. I mean, COVID is one of the viruses, but there are so many bacterial infections and viral infections that we are at risk for contracting. And a good sugar control is probably the only thing that is in your hand. We cannot control the outside environment. All we can do is, managing your mental health, your emotional health, your psychological health, and managing your sugars, because this is again all interlinked together. So stay safe, stay home, and wear a mask.